Next on the agenda is our public service announcement. Dr. Polsky for our weekly update on COVID-19.
Morning, gentlemen. I guess timing, for better or worse, coincides with the FDA announcement this morning of temporarily suspending use of the Johnson & Johnson vaccine. So just want to let everyone know that on our health department website, we have an announcement there regarding, and it may be going up on the county website as well. So I just typed this up within the last hour, and I'll read it for everyone's benefit. And again, the information, if you don't catch the details, I'm reading verbatim what is on our website at this point. So the FDA has placed a hold on Johnson & Johnson COVID vaccinations. The FDA is investigating rare blood clots. These have occurred in less than 1 in 1 million people associated with this one particular vaccine. The blood clots have been seen within 2 weeks of vaccine administration. The blood clots have not been seen with either the Moderna or Pfizer vaccines. At this point, the Calvert County Health Department will only vaccinate people with Moderna and Pfizer vaccines until the FDA concludes its investigation of Johnson & Johnson. The Moderna and Pfizer vaccines were developed using completely different technology than the Johnson & Johnson vaccine. 200 million doses of Moderna and Pfizer vaccines have been administered in the U.S. without any safety concerns. The Calvert County Health Department strongly encourages people to get vaccinated. We continue to see high rates of COVID spread in our county, along with hospitalizations and deaths from the virus. Currently, those hospitalized in Calvert include people in their 40s, 50s, 60s, 70s, and 80s. Recent deaths have included people who range in age from their early 40s to their 80s. During the past month, close to 100 Marylanders have died each week due to COVID infections. Among those who have been vaccinated, we have not seen any hospitalizations or deaths. For those who have recently received the Johnson & Johnson vaccine, the risk to your health is extremely low. Please keep in mind that the blood clots have occurred in less than 1 in 1 million people, and it is not clear that the clots are directly related to the vaccine. And so I'm going to go into a little bit of technical detail just for a bit. The type of clot seen is called a cerebral venous sinus thrombosis. It occurs in approximately 1 in 200,000 Americans on a yearly basis. This is not a clot specific to a vaccine or anything else. Symptoms include severe headaches that are generally accompanied by vision changes, problems with speech, and sudden onset of muscle weakness in one area of the body. These are also symptoms of strokes, and so anyone with symptoms that are associated with severe headaches and other symptoms should seek medical care immediately. And the health department will update as more becomes available. All right, so I'm going to turn attention to our usually weekly update. As you can see, cases have not really dropped over the past week or so. They've remained relatively stable at the fairly high rates that we've seen. By age breakdown, really some mixed news here. So among older people, good news, we've seen cases actually go down over the past couple weeks. And again, that is a result of the relatively high rates of vaccination among seniors. On the other end of the spectrum, we've seen cases rise among those below age 20. So the updated positivity rates, and it's each week over the last 4. The number of cases are in that middle column. So we did reach a high back in that 3rd week of March of about 190 cases. This past week, we were at 142, still well above what we were seeing about 2 months ago. And the positivity rate is hovering around 7%. And then I just updated the chart for this week, so still showing us in high transmission rate in terms of cases and positivity rate, sitting in the moderate. So this is the big chart showing all the doses given per county. And for the first time, our vaccination rate has actually dipped just barely below the state average for at least 1 dose. So the state average, as you can see by the giant arrow on the right side, is 35.4% of the population of Maryland. Calvert County is now 35.2%, so essentially we're right there at the state average. We had been about 2 full percent above about 2 months ago. That was around the time that the mass vaccination sites opened and doses were shifted away from us locally and over to the mass vaccination sites. For 65 plus, I think this shows that for those doses that we have had locally, we put them to extremely good use. So we are an essential tie for second place among the highest percentage of those vaccinated 65 and over. Also want to mention, as far as being good stewards of vaccine, that 89% of the vaccines that we have received, we have used for people who live in Calvert County. Now, it's never going to be 100% because there are people who work in local medical practices, first responders, other prioritized teachers who live outside of the county, but we vaccinated here. So essentially keeping 90% of the vaccines reserved for those who live in Calvert County. We are those that we control locally. We're making sure are getting to the people who need it within our borders. And because of the continued shift of vaccines away from us and to the mass vac sites, I am going to encourage people to look outside of our borders to get vaccinated. This week, we are only receiving 600 doses of vaccine at our local health department. There's still approximately 40,000 Calvert adults who have not been vaccinated at this point. It's just impossible for our local health department and the private practices here to make big headway with the amount of vaccine that we're getting. And so information for registering to be vaccinated through the health department is on the left side of the screen. But I would strongly encourage those who do have the means of traveling outside of the county to get vaccinated to consider going on the Maryland website, either calling the 855-MD GoVax or getting onto the website, which again, I'm not going to read it out, but it's on the screen. Or you can go to Maryland Department of Health website and there's a link from there to find it. I know there's been a question about for those 16 and 17 years old, because the governor has okayed anyone, regardless of underlying health conditions, to get vaccinated. The only vaccine that is approved, FDA approved for 16 and 17-year-olds is the one made by Pfizer. We have not gotten any Pfizer vaccine in months. We only actually got one shipment ever. And so the Moderna that we're using is approved for 18 and up. I will say that from a physician standpoint, I cannot see why a 16 or 17-year-old, it would be a worry for them to get vaccinated, but it's not FDA approved. So officially we cannot draw 16 and 17-year-olds in. We've had discussions with the school administration, and last Friday, Dr. Folsom and I had a web conference with all of the high school coaches and athletic directors, encouraging them, particularly for their athletes, to go outside of county, or because the mass vac sites almost always have Pfizer vaccine, and periodically the pharmacies, usually CVS or Walgreens, but there's not a consistency to it, will get doses of Pfizer that can be within the pharmacies in Calvert County. So I've encouraged the coaches to, in turn, encourage their athletes and their parents to sign up for vaccination. And that really should go for the entire, all the students across our local schools. In particular for the athletes, because we continue to see cases pop up on sports teams. And that means that any of the other athletes who are in close contact, then again, they have to be quarantined and they can't go to school. Also, if there are any playoffs at the end of the season, if students start with their vaccinations now, the second one is 3 weeks later with Pfizer, they will be fully vaccinated before playoff time hits, and they're not subject to quarantine anymore. And we have seen quite a number of colleges already announce that For any students in the upcoming fall semester, those colleges will require proof of vaccination prior to enrollment. So for those who are seniors, it's probably wise for them to go ahead and just start getting their vaccination now. So I put the slide back up that shows the pharmacies in the county that are vaccinating, but not all of them are going to have Pfizer. So parents would need to check with them on a regular basis. And for anyone under 18, parental consent for vaccination is required. I'm happy to answer any questions.
So you mentioned 40,000. Is that based on registration or population? How do you come up with the 40,000 that need to be vaccinated?
Yeah, so we know that about 32,000 people have received at least their first dose among Calvert residents. We know that there's 72,000 and change who are 18 and over. I didn't include the 16 and 17-year-olds, but for those 18 and up, so it's just a little bit of basic math.
Because we know there's a certain population out there that's not going to get the shot, so I didn't know.
Right.
Do you factor that in at all?
Yeah, and there's no way for us to know which percentage of people are going to flat out refuse. And the majority of those 40,000 are likely people who are still trying to weigh a decision. And again, I get back to, we continue to see more people hospitalized now. And unfortunately, this past week, we had 2 deaths, one person in their 50s and one person in their early 80s who died from COVID. And again, we have yet to see anyone who has completed their vaccination end up either hospitalized or passing away as a result of the virus.
So how many people do we currently have in the hospital? Do you know?
As of yesterday, there were 6 and one person who they were investigating. They had done a swab and hadn't gotten results back yet.
So have you tracked how many people have had the normal flu this past winter?
Next to none. And so that's I think one of those aspects of this that we will learn a tremendous amount. And so clearly, I think it shows 2 things. One, that keeping some distance, not shaking hands, wearing masks, not only decreases the potential for COVID, but probably even more so for the flu. And given that we still saw a significant transmission of COVID during the winter, shows how much more transmissible COVID is than influenza.
There's a different theory on the street.
Which is?
That a lot of these people that they say have COVID is just the flu.
So everyone who was tested for COVID was tested for flu. Everyone. It was a package deal. And so we can say categorically that is false. I hear you, and there's and on a daily basis, as I'm sure you can appreciate, we deal with all sorts of rumors, and again, I would encourage people that for most people who are watching this, they don't know me personally, that they should talk to their family doctor, their family nurse practitioner, someone who they feel comfortable, they develop a relationship with, and they can trust. You never ever know truly who's behind any web post, and there are people out there who are malicious, that when you're, and this goes for anything to do with your health, when you're uncertain about something and the consequences of your decision, either going ahead with something or holding back on something, either way, there's consequences for your health. And when we deal with a transmittable disease, others around you, you want to make sure that you're really getting good information and not just because something's printed on a website.
So the other thing that we hear on the news is about the minority participation in vaccinations. In Calvert, how are we doing with minorities?
We're actually doing extremely well. And so both in the general population age-wise and in 65 plus, so we're the only county in the state that has fully vaccinated more than half of its seniors, and the percentage of African Americans and the percentage of the general population have been vaccinated is absolutely equal. In the general population, we're also seeing really good equity. Now, those are vaccines that are happening within the county. We can't control, again, what's happening at mass vac sites, and we know there is inequity at the mass vac sites. And that's really a lot of grassroots work from the very beginning. I certainly don't want to take credit through the health department. Our community organizations, Concerned Black Women, NAACP, many of our local faith leaders from the very beginning, Wilson Perrin, many of our local leaders from the beginning not only got vaccinated, but were talking to people who they personally know, people in their organizations, to assure that this is the wise route to go to get vaccinated.
And Saturday, I attended the clinic at the St. Paul's Church here in Prince Rudolph, which was organized by 2 churches, so to help get the word out.
Yeah, we were extremely happy to see you there. And
So how many people did you vaccinate that day?
I didn't look at the final total. We had planned on about 350 people. And I think that was a wonderful example where we have a predominantly African-American church and a predominantly white church coming together to draw people in. And it was not exclusive to their congregations. And I know that at both those churches, they do considerable work with low-income people, people who are disadvantaged for a variety of reasons. And that was really the goal of that clinic, was people who otherwise may not have access to care, that it was a way to, again, through grassroots, people that they trust, to bring them in for vaccination.
Yeah. And just to reiterate, Dr. Polsky, if you really want a shot, you've got a better chance going outside the county to a mass vaccination site. The governor and the federal government has decided that's the path they want to take. And
Right.
They're converting those to walk-ups. You don't even have to have an appointment in the very near future. So
Right.
that's where the allocations are going to go.
And it really pains us to have to tell people to go outside the county to get their vaccines. We have the capacity to vaccinate more people. We have local practices that have the capacity to vaccinate their own patients, and we're just not getting the doses locally.
And Dr. Polsky and I have complained on the Thursday conference calls with the governor's office about that process and how it does not help our citizens, making them drive 60 or 70 or 80 miles to get a shot when we could do it right here. But
Right. And yes, and we both made it clear, and I've made it very clear through multiple channels, that to me, mass vaccines are only appropriate when you have saturated your capacity locally. Then you start to shift doses out, not preferentially treating those mass vaccination sites. So again, the reality is that for most people who are going to get vaccinated at this point, they're going to have to go outside of county unless the governor shifts his policies.
Any other questions? Thank you, Dr. Polsky.
Thank you all.
Appreciate your work.